Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television, as always. Thank you for joining us. For Your Health, well, in the title, health is in there, and that's exactly what we discuss. Various topics, we cover various topics to help you stay healthy and informed. Today we will be talking about chronic disease prevention, and with me, as in shows past, is a public health nurse for the city of Quincy, Caitlin Kirby. Caitlin, welcome back. Always, always, always a pleasure to have you.
Always a pleasure to be here.
This particular topic, chronic disease prevention, it's going to kind of cover a variety of health concerns or health topics.
Yeah, so it's really about health maintenance in total.
Better said than what I just said.
Because every time I come, no matter what topic I'm covering, when we get into preventative measures, a lot of it lines up together, because the body, obviously, every organ works together to operate. So it's really try how to live a healthier lifestyle in total.
So let's look at the outline so folks at home know what to expect. We will talk first about facts about chronic diseases, how to prevent chronic diseases, quit smoking, eat healthy, regular physical activity, avoid drinking too much, additional tips for health maintenance, and lastly, we will talk about resources. So facts about chronic diseases.
Yeah, so a lot, and all of this information, I just want to say to start, I did get from the Center for Disease Control and Prevention, otherwise known as the CDC, which is very universal, and most state guidelines go exactly by the CDC. So according to the CDC, 6 out of 10 adults in the United States have a chronic disease, and 4 out of 10 adults have 2 or more chronic diseases. So it's very prevalent within the United States. And when we're talking about chronic diseases, they are defined broadly as conditions that last 1 or more years. And require ongoing medical attention, and they can limit activities of daily living. And then chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability within the U.S. So there are many more chronic diseases, and as we get into each preventative topic, I will probably list a couple more. But those are definitely heart disease, cancer, and diabetes are 3 of the biggest ones that we see.
Again, you had mentioned this prior to the recording today. A big part of what we talk about in every program is prevention.
Yes.
If you can prevent it in the first place, you're ahead of the game.
Yes, because if you think of it, once you have the condition, it's a lot of upkeep to make sure you're managing it appropriately. A lot of doctor's appointments, it could be costly with hospitalizations and medications. So preventing it in the first place is always key. So we'll go through different topics on how to identify what condition you may have and how to prevent it from the start.
So, how to prevent chronic diseases?
Yeah, so a lot of chronic diseases are caused by a short list of risk factors. And so these risk behaviors, they include smoking and exposure to secondhand smoke, poor diet, physical inactivity, and excess alcohol use. So as we go forward, we'll dive deeper into each one of these and the harms that it can be causing yourself, and especially when we're talking about smoking, the harm to others around you as well.
And that's the next topic, is quit smoking.
Yeah, so according to the CDC, more than 16 million Americans are living with diseases caused by smoking. So tobacco use and exposure to secondhand smoke can lead to serious health problems, including cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, otherwise known as COPD. And smoking also can increase your risk for conditions such as tuberculosis, which is an infectious disease. Also, it increases your risk for certain eye diseases and problems with the immune system, including rheumatoid arthritis.
Interesting with eye disease.
Yeah, so if you think about it, where it's affecting your, where it can lead to heart disease, that's affecting your whole body circulation. So the circulation to the blood flow to your eyes is impaired. So it really affects every organ within your body.
I get it now.
Yeah. and-
Secondhand smoke.
Yeah, so secondhand smoke exposure. So we tend to think, a lot of people unfortunately think when they're smoking it only affects them. But you really need to think about those that are around you when you are smoking, because the secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year, which is a very high number, of course. And children that are exposed, they are at an increased risk for sudden infant death syndrome, acute respiratory infections, middle ear disease, severe asthma, respiratory symptoms, and slowed lung development. So it's very important. I know back in the day it was very common to smoke in the car with your children in the back seat. It's very frowned upon because you really are harming their body for the long term.
I was talking to a colleague of yours, and she had mentioned there's such a thing as third-hand smoke. And she said when smoke is absorbed in, I suppose, furniture, that is considered third-hand smoke. So there's obviously the first-hand smoke of the smoker,
Yes.
the second-hand smoke of whatever, maybe whoever is close by, and then the fact, third-hand, I guess, whatever stays behind.
Yes, because so if you think of that third-hand smoke, where if you're smoking in the car, the infant's car seat can absorb it, the blankets that they're utilizing can absorb it. I know Christine with the Quincy Health Department, our tobacco specialist, she can go a lot more into it, as I'm sure she did in her program. But it's very important to know your risk factors, and when in doubt, especially for residents in Quincy, you can always reach out to Christine if you have questions or concerns.
Eating healthy, always a good idea. Not
Yes,
always easy to do. Well, actually, you know, it's easier than people think.
easier than we think. It's very hard with, like, right now, access to food. It's so easy to go to a drive-through and so forth. And we've been told this since the beginning of time to eat a good, healthy diet.
And isn't there a way when you go shopping, isn't there a way you should be going through a grocery store?
I would have to do a little bit more research on that.
But I think the way things are set up in a grocery store, if you shop around the perimeter, I think that's where the healthier.
I could say that just from personal experience
Produce is.
going to the grocery store, I
Sure.
start with my produce. My grocery cart looks very healthy. Get to those middle aisles, and that's where you find the cookies and the chips.
So exactly.
And so that
Okay.
that does make sense. And as we all know, all of our viewers at home, good nutrition is essential for keeping current and future generations healthy across their lifespan. Adults who eat a healthy diet live longer and have a lower risk of obesity, heart disease, type 2 diabetes, and certain cancers. And healthy eating can help people with chronic diseases manage these conditions and avoid further complications along with that chronic disease. So a balanced, healthy dietary pattern includes a variety of fruits, vegetables, whole grains, lean protein, and low-fat dairy products. And you want to make sure that you're limiting your added sugars, saturated fats, and sodium. So definitely the perimeter of the store, getting the produce, the the different meats for your protein. But a key, because I know a lot of times, sometimes you got to do what works best for you. Like if you're going to buy a month's worth of vegetables, but they're all going to go bad, it might be easier to do canned vegetables.
Or frozen, and
Or
just keep them
frozen.
frozen.
Because then they can last longer. So you need to do what works for you or your family. So what the American Heart Association has done is they have a label. I do have a photo of this on our slides. It's an American Heart Association certified, and it's like a check within a heart. And that check mark on certain brands, it means that that food item meets the nutrition requirements for certification that are based on sound science of the American Heart Association, and it takes into consideration healthy dietary recommendations, including food categories, specific product ingredients, and nutrient values. So maybe those like the fresh vegetables might not work for you in your home. So if you do go a canned option, make sure you're looking for that label to make sure you're reducing your sodium and so forth.
Be careful with sodium, because sodium, as you're reading labels, that can be a surprise to folks.
Yes.
How much sodium is in any given product.
Yes, that, and then also with sugar. Sugar is really sneaky as well. So you want to make sure you're really taking a look at that label. And also they say to take a look at the ingredients, because there's a lot of additives in our food items in the grocery store that aren't good for our overall health. So
you're talking probably processed food.
Yes. So you just want to make sure you're picking your healthiest item you can when you're making those choices.
And the Heart Check Food Certification Program, which I was unaware of until you brought that up.
Yeah, so it's and that's amazing that they have that, because again, when you go to the grocery store, there's hundreds of items. You go to get a canned green bean and there'll be 15 different types. So it's definitely very useful to look for, and like more convenient than choosing yourself.
And mentioning that, and green beans, I guess, or another vegetable, if they do come with or in a sauce, you've got to double check, because a lot of times that the vegetable might be fine, but the sauce, whatever that sauce is, cheese sauce or what have you, that's where those ingredients that aren't as healthy for you live.
Yes, yeah. So it's definitely just make sure when you are picking out what you're going to buy that week, just try your best to pick the healthiest option. Because then I'm very guilty if I buy myself a bag of chips, they're going to be gone in 2 days. So it's like...
Well, and that's not saying... We all like to, the word maybe cheat, but maybe not. I have a sweet tooth. I mean, I can't not have a cookie, and that kind of thing. But the other thing is serving size. So if you limit yourself, you have your cookie, but you have, I think serving size on most cookies is probably 2 cookies. So just leave it at that. Don't eat half the package.
Yeah, and it can be hard to do, but definitely you want to just take into consideration and just try your best to make healthier options when you're choosing your snacks. One thing, like in our household, I know I can't bring a pack of cookies home because, again, they're going to be gone. So instead, we try to do a healthier option like snack on popcorn. And again, read your labels to know which one, because a lot of those can also have a lot of added butter and sugars and so forth.
Physical activity, and we're talking about regular physical activity.
Yes. So regular physical activity can help prevent, delay, and manage your chronic diseases. So according to the CDC, you want to aim for moderate intensity physical activity. So this could include a brisk walk or gardening for at least 150 minutes a week, and a muscle strength training activity for at least 2 days a week. And every time I mention this in previous episodes, when we talk about increasing your physical activity, we're not telling you to go out and run a marathon or walk 5 miles. It's slow progression, and it's also doing what you can do, because many people who do experience chronic diseases, they may have different limitations that it's not as easy for them to go out and walk a mile.
And isn't it better to do less, I suppose, in an extended period than to do all of it at once anyway?
So I can't say for certain. I'm not quite like a physical trainer per se, but definitely just if you overexert yourself. I've done that where I've gone to the gym and I've done a program and overexerted myself, and then I won't go back to the gym for 2 weeks because I'm recovering. So definitely take it slow and build a progression. Also, when you add it in small intervals, it's easier to manage and it's easier to kind of tackle that. And as I mentioned,
You won't get overwhelmed.
yeah, because it's easy to. And definitely if you do have a chronic illness, make sure you're checking with your doctor. They could always refer you to a physical therapist if necessary, and they can help manage and advise you on the best ways to exercise. And I always like, in the Quincy community, our Quincy Council on Aging at the Kennedy Center, they have amazing exercise programs that come right to the Kennedy Center. They have Tai Chi, chair yoga, Zumba, so it's all different levels. So definitely in your community, you can reach out to local gyms and see what they offer, or your local council on aging to see what programs they may have. Because there's a lot more out there that you don't realize, and it might be fun. Like, it might be fun to join a class, and if you don't love it, you don't have to go back. But I always like to give something a shot, just to, you may like it and surprise yourself.
Absolutely. Avoid drinking too much.
Yes, so this topic's a little bit longer. Over time, excessive drinking can lead to high blood pressure, various cancers, heart disease, stroke, and liver disease. So excess alcohol use led to more than 140,000 deaths and 3.6 million years of potential life lost each year in the United States from 2015 to 2019. And this would be shortening the lives of those who died by an average of 26 years.
That's a lot of years.
Yeah, so there's short-term health risks that can be associated with over drinking, and also long-term health risks. So when we're thinking of our short term, we can see injuries. So this could be in reference to motor vehicle crashes, falls, drownings, or burns, because you think if you are over drinking, it leaves you impaired. So you can't appropriately you're not thinking clearly to keep yourself safe. We also see with excess alcohol, increase in violence. So this could include homicides, suicides, sexual assault, or intimate partner violence. We see alcohol poisoning, also risky sexual behavior, which can lead to unintended pregnancy or sexually transmitted diseases. And then for pregnant women, it's definitely not advised to drink while pregnant, because complications that can arise are miscarriages, stillbirths, or fetal alcohol spectrum disorders for that infant if they are able to survive the pregnancy. So those are some of the short-term risks we see, which are very, very severe, of course. And then for individuals who long-term have excessive alcohol use, we see an increase in hypertension, heart disease, stroke, liver disease, and digestive problems. And I also had mentioned cancer. So a lot of cancers that we could see are an increase in breast cancer, mouth cancer, throat, esophagus, voice box, liver, colon, and rectum. We also see a weakened immune system, learning and memory problems, mental health problems, including depression and anxiety, social problems, because if individuals are over drinking, they may have problems like family related, job related, and even unemployment if they cannot maintain a job. And then of course, this seems pretty obvious, but alcohol use disorders and alcohol dependence. So definitely if you or a loved one you know is struggling with alcoholism, make sure that you're and it's tough to say, but there's a lot of resources out there. And on our last slide, I do have a resource link to the CDC, and they have many resources out there in the community for you to reach out to for help and support.
And I guess the last topic for today, well, before we get to resources, additional tips for health maintenance.
Yeah, so along with, of course, eating healthy, quitting smoking, regular physical activity, and avoid over drinking, these health maintenance tips are very common. You hear them all the time, but you want to make sure you're keeping up to date with your doctor's visits, because this enables you to prevent chronic diseases or catch them early. In that way, your doctor can implement preventative services, especially if you are diagnosed with a disorder. They can help you manage it before you get further complications. You also want to maintain your dental health, because oral diseases, which range from cavities and gum disease to oral cancer, cause pain and disability for millions of Americans. To help prevent these problems, you want to drink fluorinated water, brush with fluoride toothpaste twice a day, and floss daily. And you want to make sure you're visiting your dentist at least once a year. And that is even if you have no natural teeth or use dentures. It's still very important you're following up with your doctor, with your dentist, as well as your doctor. You want to make sure you're getting enough adequate sleep.
And what is the, I suppose, sufficient sleep for folks? It probably varies slightly.
So it can vary slightly, but according to the CDC, adults are recommended to get at least 7 hours daily of rest, because insufficient sleep has been linked to a development and poor management of diabetes, heart disease, obesity, and depression. And then lastly, you want to know your family history, because a lot of these chronic diseases can be hereditary, where it's passed down through your family. And some conditions, like many cardiac conditions, that hereditary factor could also be because you're living similar lifestyles. A lot of lifestyle factors go into these conditions, as we've reviewed today. So if your family has a history of chronic diseases such as cancer, heart disease, diabetes, or osteoporosis, you may be more likely to develop them. So make sure that you link up with your doctor, that they're aware, and that way they can take appropriate steps to prevent further complications, and also implement screenings to catch things early, because the earlier you know, the better you can prevent it from progressing to its worst stage.
Well said. We could end right there, but we won't, because resources, that's equally important.
Yes. So definitely, so again, all of the information I did obtain today was directly from the Center for Disease Prevention and Control. So if you go right to their website and look up chronic disease, all of these preventative measures will pop up. Each page, each topic has its own page, I should say. So whether it's quitting smoking, increasing physical activity, eating healthy, there's many different resources to take a look at and to look for your own community. So I definitely say take a look at that site. And then also you could reach out to your local Board of Health. They may have different programs that you may be unaware of in your community. For example, our tobacco specialist who just started in the department approximately a year ago now. But for individuals looking to quit smoking, Christine is the specialist and can help you with that task. So definitely look on the CDC. You can check out your local state website as well. But again, that local Board of Health is a great resource to reach out to, because we have, if we don't know the answer, we look into it and try to direct you in the right way.
Great. Well, you are a great resource for the City of Quincy, and we certainly thank you for sharing your knowledge with folks here in the city, but beyond as well.
Yes, it's always a pleasure to be here. And again, I always like to use like the CDC and the state health department. It's where I obtain all my information. So it is very universal, whether it's in the state of Massachusetts or beyond.
And delivery is important, and you certainly deliver the information in a, I suppose, well put together manner.
Thank you. I appreciate that.
Thank you. Until next time.
Yes.
And thank you at home for watching. And just please remember to support your local access television station in the community in which you reside for programming just like this.